fitness and activity assessment in adults. This is Chapter 9. Objectives. Identify and define components of health-related physical fitness and the risks for fitness testing. Use measurements of aerobic capacity, body composition, and muscular fitness. Identify test items designed for older adults, and understand the issues with measurement of physical activity in all populations. Physical fitness. Multifaceted objective with different meanings for different people. Two factors provide the framework for defining physical fitness for any person. 1, purpose of the test, and 2, define population. Populations and purposes of physical fitness testing. Table 9.1. Population. It could be health-related, motor, to get a diagnosis, military preparation, or functional capacity. Health-related fitness factors and benefits. Now you see the factors on the left-hand side, and then you see all the benefits of why you would want to do this test on the right-hand side. Supporting evidence for health-related fitness. Epidemiology examines the incidence, prevalence, and distribution of disease. Relative risk, the risk of mortality, death, or morbidity, disease associated with one group compared to another. Physically active groups have lower relative risk of developing fatal cardiovascular disease, CVD, than sedentary groups. Inverse relationship between death rates and cardiovascular endurance. People who suffer from obesity have higher rates of CVD, cancer, and diabetes. Inverse relationship between muscular strength, obesity, and all causes mortality after controlling for cardiovascular endurance. Major risk factors and classifications for cardiovascular disease. You see the risk factors on the left and the classifications on the right. Here's a physical activity readiness questionnaire. Here are conditions requiring exercise stress tests, medical exam, and medical supervision. Here's the relationship between cardiovascular or cardiorespiratory endurance and cardiovascular death rate. Measuring aerobic capacity. Aerobic power is the ability to supply oxygen to the working muscles during physical activity. Laboratory versus field methods. Laboratory methods. Maximum oxygen consumption, which we call VO2 max. It's the most reliable and valid measure. Expired gases are monitored with a gas analysis system during maximal exercise performance. Can be difficult to measure due to expensive equipment, exhaustive exercise performance, and time restrictions. Other laboratory methods for estimating VO2 max would be maximal exercise performance, submaximal exercise testing, and perceptual effort during exercise testing. Relative intensity scale. Sitting, 0, 10, maximal effort. Important facts concerning laboratory testing. Equipment should be calibrated and checked. Test administrators should be trained and qualified. Practice tests. Standardized testing procedures. Treadmill VO2 max values are greater than cycle ergometer tests. Cycle ergometer tests can produce artificially low values. Most people don't ride bikes daily. And submaximal VO2 max estimates typically have a formula there that you can see that's greater than 5. Field methods. Distance runs, step tests, Rockport 1 mile walk test, and predicting VO2 max without exercise. Measuring body composition. Obesity refers specifically to overfatness, not overweight. A well-muscled athlete may be overweight, but may actually be quite lean. Measuring body composition involves estimating a person's percent body fat. Body composition can be looked at as 2 components, lean body mass and fat mass. Here are some other ways for measuring body composition. Hydrostatic weighing, dual energy X-ray, air displacement, CT scans, isotopic dilution, ultrasound, anthropometry, which is the skin fold and girth, bioelectrical impedance analysis, BIA, total body electric conductivity, and near-infrared interactance. Calculating body density and percent body fat from hydrostatic weighing. And there's your formula right there. You're going to calculation the fat, lean, and target weights. So you got your fat, your lean, and your target weight on the left, your calculations in the middle, and the results on the right. Skin fold assessment, most reliable, valid, and popular field method for estimating percent of body fat. Uses skin fold calipers to measure skin folds in multiple sites to estimate percentage of body fat using predictions and equations. There's a skin fold caliper. There's another one. BMI, simple measurement expressing the relationship of weight to height. So your BMI equals weight over height. Commonly used in epidemiology research and acceptable for those people who are obese, but may produce inaccurate results for people who are lean or of normal weight. Disease risk relative to normal weight and waist circumference. Measuring muscular strength and endurance. Work, result of physical effort. Work equal force times distance. And power equals divided by time equals weight divided by time. Measuring muscular strength and endurance. Muscular strength, force that can be generated by contracting muscles. Torque is the effectiveness of a force for producing rotation around an axis. And muscular endurance, physical ability to perform work. Measuring muscular strength and endurance. As we continue, it's relative endurance, measurement of repetitive performance related to maximum strength, and absolute endurance, measurement of repetitive performance at a fixed resistance. Here are types of contractions measured. We've got concentric, eccentric, isometric, isotonic, and isokinetic. And those are just different forces within the muscles. Laboratory methods, computerized dynamometers, biodex, back extension strength tests, and non-computerized dynamometers. Handheld, that's a big word to say. Manual muscle tests, precursor to HHD testing, most often used in clinical situations to assess muscle strength, and patients are given a rating from 0 to 5 based on their ability to move a joint through a full range of motion against gravity. Field measures for strength and endurance involves lifting external weights or the repetitive movement of the body. Muscular strength is 1 repetition, maximum, 1 RM, and muscular endurance is maximum number of repetitions with a submaximal weight load. 1 RM values of the bench press and the leg press, upper and lower body strength. YMCA bench press test, upper body endurance, and push-up test, which is also for upper body endurance. Trunk endurance is, you could use the YMCA half sit-up test or the curl-up test. Measuring flexibility, range of motion of a joint or group of joints. Flexibility is joint specific. Laboratory methods is a gynometry, visual estimation, radiography, photography, linear measurements, and a trigonometry. Boy, these are like big words. Trigonometry, there you go. Field methods, trunk flexion, sit and reach test, and your trunk extension. Here's somebody doing the sit and reach test. Health-related fitness batteries, YMCA Physical Fitness Test Battery, Canadian Standardized Test of Fitness, and the President's Challenge Adult Fitness Test. The YMCA Physical Fitness Test Battery is used by the YMCA to assess physical fitness of its members. Easily adaptable to many adult physical fitness testing situations, and the test battery includes the following components: height, weight, resting heart rate, resting blood pressure, body composition, cardiorespiratory endurance, flexibility, and muscle strength and endurance. The Canadian Standardized Test of Fitness is a Canadian fitness survey conducted in 1981 to develop an understanding of the fitness level of the Canadian population. The test battery includes the following components: resting heart rate, resting blood pressure, body composition, cardiorespiratory endurance, flexibility, abdominal endurance, and upper body strength and endurance. And then you have the President's Challenge. Online adult fitness self-test, you can find that at adultfitnesstest.org. It's designed to be self-administered, however, a partner is needed to complete. And your test battery includes the following components: aerobic fitness, body composition, muscular strength and endurance, and flexibility. Physical fitness assessment in older adults. Defined as persons age 65 and over, highest rates of chronic diseases, health care costs for older adults are contributing to health financial problems, and studies show that older adults respond to appropriate endurance and strength training programs similar to younger adults. Here are the parameters and items of the older adult fitness test. On the left, you have the physical fitness parameter, and then you have the different test items on the right. Special populations include people with physical or mental disabilities or both. Valid and reliable fitness assessment of adults with disabilities is not a well-researched or well-understood topic. Fitness assessment should include these: anaerobic power, anaerobic capacity, electrocardiographic response to exercise, muscular fitness, and body composition. Measuring physical activity, which we say PA, is the behavior of bodily movement that requires the contraction of muscles and the expenditure of energy. The roles of measurement in PA, amount of sedentary behavior, role of PA in health status, factors relate to PA behavior, and the effects of interventions to promote PA. The relationship of health-related fitness to the physical activity pyramid. Here's the physical activity of assessment and age groups of the population. Here's single response physical activity scales. There's 5 levels, from I don't exercise to I have been moderately physical activities 5 or more times a week or longer. Steps per day, as it indicates for public health for adults. And what's great about the steps per day is the Apple Watch, or there's just a lot of pedometers out there that will count your steps. And that's a great thing that we have now to measure if we're active. Measuring muscle strengthening physical activity, adults should engage in moderate or high intensity muscle strengthening activities on 2 or more days a week in 7 major muscle groups. And muscle strengthening activities have numerous health benefits in addition to those provided by regular physical activity: increased bone mass, improved posture, improved glucose tolerance, ability to conduct daily activities, and increased resting metabolism. The certification programs, you could do health fitness certifications. There are clinical certifications, and there are national strength and conditioning associations. And there's a lot more certification programs out there, including some that I have in my company, which are Christian-based and address the spiritual part of fitness, not only the physical part. Summary. Various factors are involved in assessing adult fitness and physical activity reliability and validity. Mastering the material does not make you qualified to administer, but it's an important step. And seek out appropriate education and training to obtain the correct certifications.